I got to tell you, I'm excited about the potential for the best healthcare for rural Saint Croix. And I say rural Saint Croix because, I mean, that really is redundant. Saint Croix is a rural community by definition. And today we are talking about number three of my solutions for Saint Croix. Healthcare, specifically bringing a healthcare center, a team-based healthcare community center to our riding of St. Croix. Building on the last couple of days, this is part three, so I'm not going to repeat too much. Go back if you've missed. I want to talk about the government's budget for healthcare. This year, out of a $13.3 billion budget for 2024-25, our government has set aside $3.8 billion for healthcare to dispense those out to the regional health authorities. Remember, there's two, Horizon and Vitalité. That's in part one. And last year, in the previous budget, there was $3.6 billion set aside. So we are not talking a lot. With $200 million, there has been no significant increase in investment for the budget. I don't need to tell you how disappointing that is as someone who uses the hospital system, uses our healthcare system, doesn't have a family doctor. Me and my family, the four of us, we are one of 92,000 New Brunswickers without. I want to show you. So there's of course, you're disappointed. I'm disappointed. When I knock on the doors, that's the first thing in everybody's mind. I want you to read the New Brunswick Medical Society's statement on the budget. Okay, so I'm going to bring that up because it's important for you to hear what the experts have to say. Sometimes you might think, oh, Mark's running for MLA. He's being political. He's going to attack the government. I hope I never just get involved in partisan attacks. I never want to see that. I don't like when I see it. I don't want to participate in it. I want to give credit where it's due. That's why it's important to read a statement like this. So I'm going to spend the time that I have showing you the statement that the New Brunswick Medical Society, the New Brunswick Medical Society represents the 2,000 doctors, past, present, and future doctors in the province of New Brunswick, and so made up of physicians. They assess budgets and plans. They're going to come up in the next couple of days as well as I discuss this. But let me read their response. Physicians disappointed with provincial healthcare budget. This is from the New Brunswick Medical Society's website. You can check that out. New Brunswick physicians are concerned with the effective year-over-year freeze of healthcare spending reflected in today's provincial budget announcement. You can see the date there. This came right after the announced 2024-25 budget. They call it essentially a freeze. We are in crisis, and this government refuses to spend any more money. You might think that that's prudent. It is not, and we can talk more about that. I've got 100 more episodes to go till Election Day. While we appreciate, it continues, that the elimination of expenses such as travel nurses may allow for certain additional investments, so they've stopped the travel nurses. I do plan to talk about that as well. This budget is far from the commitment of health system transformation that healthcare professionals were hoping to see. Far from the commitment to healthcare transformation. We need a transformation. The medical community is calling for it. It's far from that. In particular, the absence of any significant retention initiatives is surprising, given the human resources challenges we are facing. No retention, which means essentially we're going to continue to pay nurses the lowest salaries in Canada. The Medical Society is definitely opposed to that because they believe in and are huge preponderances of team-based care. I'll continue. We are pleased to have several pressing issues recognized in this budget. Good, including a $22.9 million investment in clinical information systems. We talked about the communication piece being a problem yesterday. Although more than 20 years overdue, they take a little shot there. And this is a trend. You'll see things like the housing crisis, the medical crisis, 20, 30 years in the making. It arrives, it hits, and we still don't have the means to address it. This is the kind of thing they're talking about. And that is, as I go to the doors and I hear people talk about the ping pong of liberal and conservative governments, status quo, nothing changing. This is an example of that. Any improvements to the province's healthcare technology infrastructure are welcome. Okay, so they do say that. Now I have one more page to share before I'm done the 5 minutes, which is going to be longer than that today. It is also encouraging to see funding allocated to primary care. While significantly less than what is needed to adequately address primary care across the province, 20 million is a step in the right direction. I almost feel like this is tongue in cheek. I might be reading into it, but when you're talking about a $3.8 billion budget, $20 million more is essentially an adjustment for inflation. It is somewhat concerning, they go on, that no parameters or benchmarks have been indicated to guide these investments. No plan, folks. That's what that means. Hopefully, government will take a collaborative approach with stakeholders in determining how best to allocate these funds. I do want to talk about the plan that the government has been working on, building on another plan from 2017, which has had a lot of trouble getting traction. Last paragraph here. Investments targeted at defraying inflation are also disappointingly low. While it represents a significant portion of the budget, the $70 million for regional health authorities, remember our two, Vitality and Horizon, is barely sufficient to maintain the status quo. We are not at least maintaining the status quo, which is already eroding as doctors retire. That's what this is saying. Anyone who has visited a hospital in recent years knows the status quo is not an acceptable goal. Hours of waiting in emergency rooms, waiting rooms, can't get a family doctor on waiting lists. That's the status quo right now. And that is what the government is saying, because money talks, the budget talks. The government is saying, get ready for more of that. Okay. The New Brunswick Medical Society is concerned that RHAs, the regional health authorities, will be put in a position to relying on finding efficiencies and cutting costs in order to maintain service levels. Can you imagine cutting costs in healthcare right now, the way things are? This has been the approach for many years now. The Greens, Megan Mitton, David Kuhn, Kevin Arsenault, our Green MLAs in the House, soon me to join, advocating, championing for their ridings, but also ringing the bell and saying, status quo, since the previous government and before, is not enough. These things do not catch us by surprise, friends. They are years in the making. We need to make investments. You'll hear me talk about this a lot. It is an investment to put money into healthcare, not an expense. Okay, that's kind of accountant speak, and you do need some of that. But I want you to think about how many people are not moving to New Brunswick because we are the most dissatisfied province in the country with our healthcare system. Okay, over 80% of New Brunswickers say they are dissatisfied or strongly dissatisfied with their healthcare. I have been invited to move to the United States many times. I have had opportunities open up, move to the US. Do you know why I didn't? Because of the healthcare system. As an entrepreneur, solopreneur, now my own corporation, I knew that I couldn't just sign on to some healthcare plan with work down there. I wonder how many people are making a similar decision with New Brunswick. That's why it's an investment to have a robust healthcare system that meets the standards of the national, the Canada Healthcare Act, and brings people here to live and work and pay taxes. That's an important investment in our future. All right, that's about all the time I have today from the Airbnb dispatches from family vacation. I'm going to continue making these videos the same way I'll continue working for you and letting you in on the thoughts, the processes, the things that are going on when I become your MLA. So I'm just going to come back around and say, I'm really excited at the possibilities of community health centers, and I want to get more into the details of that tomorrow. What is a community health center? What are the models? Where do they exist? Why and how